excited to have you all here this evening along with our very special guest. Thanks for joining us, Isabella.
Thank you for having me, Abby. I'm really excited.
We're really excited to have you here, and thank you so much for your time. I know it's a very, very busy month for you guys, and we'll hear about that shortly. I thought to start, Isabella, you could just tell us a little bit about your background and how you got involved with QENDO.
Yeah, definitely. So I currently hold a Bachelor of Education in Primary Education from UQ, and then I'm in my final year of nursing for a Bachelor of Nursing at QUT at the moment. So I could say I have a very big love of learning and love study. So I was diagnosed with endo in 2015 after a long road to get that diagnosis. And from there, I found the QENDO blog when I was just looking for people's experiences with endo because I never knew anyone else with endo. So the QENDO blog just really validated my experiences, and I just knew that I wasn't alone. And then from there, I attended a few QENDO events and eventually joined the team because I was just so impressed with the amount of support they provided people, and I wanted to be able to make a difference in the lives of other people who are affected as well. So from there, I joined the team in 2017. And I was a QENDO Meet facilitator, so hosting our support groups that are called QENDO Meets. And from 2019, I've been a part of the QENDO Management Board. And I love being a part of the board because it just means that I get to actively make change for those affected by endo, adeno, PCOS, and infertility every day. I get to help develop new initiatives and programs and resources, and I can help so many people. And it was my endo diagnosis that led me to make me want to actually go back to uni and study nursing so I could have that greater impact from a health perspective around helping people with endo, adeno, PCOS, and infertility.
Oh, amazing, incredibly inspiring. And we're so grateful for your openness and willing to share your story with us tonight as well as we get a bit more into that.
So yeah, tonight I'm going to be speaking on the myths around endometriosis and also just the role of inflammation. So in the drop bios or the drop-ins, oh, are you there still, Abby? I can't hear. I think my mic.
Oh, yes, I just went on mute to not be so distracting.
No? Okay, that's fine. Not a problem. I just
Yep.
wasn't sure. Sorry. So yeah, in the drop-ins correspondence around tonight's event, they've been talking about the number of people that are affected by endometriosis. So I just thought I would really hit home with this statistic. So in Australia, 1 in 9 people assigned female at birth will be diagnosed with endometriosis by age 44 in Australia. So that was from a study done, a prevalence and hospitalizations report from 2019. So it's got a really big impact in Australia and is as common as diabetes or asthma, but we just don't have that same amount of awareness. So I did briefly talk a little bit about me before, but I suffer from endometriosis myself. I also have adenomyosis as well. I'm passionate about educating and empowering others to make informed decisions around managing their chronic conditions and health in general. I'm also the host of QENDO's podcast, Let's Talk Period. So we're currently doing season 2 of that one. And I was also the 7 News Queensland's 2020 Regional Young Achiever of the Year last year. And as of last week, I was announced as semi-finalist for the 2021 SOR Optimist International Women Empowering Others Award. I also love relaxing at home and watching Netflix in my spare time. And I also love going out for brunch with friends. So that's a little bit about me. Now, I thought I would share a bit about my journey with endometriosis because a lot of people only really talk about getting that diagnosis and not the in-between part. And I thought it just might be a nice sort of way to show the ups and downs and how long it actually took to get that diagnosis. So My first memory of experiencing pain or heavy bleeding and things like that was about 2008. So I was actually 14 years old. So I started getting my period at 12. We're getting a bit, we're not talking about TMI tonight because periods aren't TMI in my books, but we're talking all about periods and things like that tonight. So hopefully everyone's comfortable with that. But yeah, so my first period, I got that when I was 12 and I was okay for those first couple of years. But when I turned 14, I just remember things getting really quite bad. I'd get horrible back pain a week before my period, and then it would be so heavy I'd have to sleep on a towel. I'd be bleeding through my school skirt, having to tie my jumper around my skirt and lower my bag straps. So my backpack was really low and no one could see my skirt. And, I just thought this was normal. My mum was like to me, "Oh, I hope you don't have endometriosis." And that was the first time I kind of heard of that. And we just sort of kept an eye on it for 2 years and it didn't get any better. So then in 2010, I did go to the GP with my mum for some assistance because this just wasn't working for me. It was horrible. I was missing my after school job because I'd just be in so much pain and I'd have had to make it through school all day that when it got time to having to actually go to my after school job, I just couldn't hold it together anymore. And so I was offered the oral contraceptive pill to manage these symptoms, and that worked for a while. So 2010, most of the time, I was able to skip my period, and that was, a relief because I wasn't bleeding through my skirt anymore. I was actually able to go to work after school. I could go swimming and do all the things that I like to do. But by 2012, that wasn't very effective anymore. And that heavy bleeding returned, my pain continued, and then I was starting to experience breakthrough bleeding as well. So I was just beginning to bleed all throughout the month, just like a continuous period. And so it was just a horrid time in general. And so by the end of 2012, I finally got referred to an obstetrician gynecologist by my GP. I went and saw that ob-gyn. They didn't do surgery. So she referred me on to another ob-gyn. So I saw them and they thought, yeah, you might have endo. So in 2014, I had my first laparoscopy, but that was inconclusive. They couldn't find any signs of endometriosis. So he said to me, "Look, I think you might have PID, which is pelvic inflammatory disease. Here's some antibiotics, and you might have trouble getting pregnant. So come back and see me when you need IVF. I don't need to see you again," and sort of brushed me off. So I was like, okay. So I took the antibiotics and I was still in an incredible amount of pain all the time, was bleeding quite a bit. I was also severely anemic and no one seemed to be listening. So I went back to the GP again for another referral and I saw yet another ob-gyn. This one specialized in high risk pregnancy. So he told me to switch pills. And I think this was my fourth or fifth different type of pill by then. So he said, switch pills, come back and see me in 3 months and see how you go. And I left that appointment and I just sat in my car and cried because, I was just in so much pain. I was in bed all the time because I couldn't function like a normal human being. And I thought, okay, enough's enough. I swear I have endo. Like, what can I do? So I researched and, went down a rabbit hole, Facebook groups, things like that. And I actually found out there are specialists or ob-gyns who specialize in endometriosis. So I went back to my GP yet again and I asked for a referral to an endometriosis specialist who I had researched. And I said, I don't want to be referred to anyone else. This is who I'd like to see. And so then I saw that specialist on the Monday in 2015 in July. And then by the Wednesday of that same week, I was in for a laparoscopy for endometriosis. to just explore to see if I had it. And so endo was found, and also signs of adenomyosis. So I was given 2 Mirena or Mirenas, so 2 IUDs inserted, and also using the oral contraceptive pill to manage those conditions. So for 2 years, I had quite a bit of relief. Things were so much better. I could actually not be in bed all the time. I was able to finish my uni degree. I was able to start my first job teaching. I was able to exercise again, which was amazing. I started to get some quality of life back, which was just such a relief. Like, it was bittersweet to be diagnosed, but so amazing to be able to get that quality of life back. So then in 2017, I did have to have a hysteroscopy because my IUDs decided they didn't like me very much, and they did move down into my cervix, and they dropped. But I got new ones put in, and they stayed put until this year. So in January, I went in for my third laparoscopy, and I had some new endo found, and that was on my bowel, or close to my bowel, and on my bladder as well. So that was removed. And also my adenomyosis diagnosis was confirmed, and that's actually progressed. But I'm 6 weeks post-op at the moment, and I'm doing so much better. So that's just a little bit about my journey with endo.
Isabella, I have to sort of pop up here and just say,
Yeah.
you know, my heart goes out to you. It just sounds like such a huge journey to go through. And, you know, I'm just amazed and really commend your tenacity to kind of keep going back and searching for the answers. I mean, obviously you were incredibly driven to do that. But, you know, obviously you were doing that throughout going through school and trying to work. And yeah, I'm just really want to thank you for sharing that with us, because I think there's probably some people here listening who are relating, and then there's probably some people who are fairly shocked really around what goes on. And it's so incredibly important to be having this conversation. There's already lots of questions coming through, so
Oh, amazing. I
continue.
can't
But
wait to answer them all
yeah,
too.
yeah, but
Great.
yeah,
Thank you, Abby.
thank
Yeah,
you.
and that's why I did decide to include that slide, because I think people sometimes forget, when they've got that diagnosis, what it actually took to get it. So it actually took me about 6 years between the onset of my symptoms to actually get a referral to a gynae to actually listen, and then it was inconclusive. So it is a lot of advocating for yourself. It's having a support person with you to advocate for you as well. So my mum was amazing with that. She would come with me for my appointments and say, look, no, this isn't okay. So just a little bit of advice before we do questions and answers. Please don't give up. Keep advocating for yourself. So what is endometriosis? So endo is a disease, an inflammatory disease, where tissue that is similar to the lining of the uterus, or the endometrium, so the inside of our uterus, it actually is growing. This tissue is growing in other areas of the body, usually within that pelvic cavity. So those red little dots on the graphic on the right, with the slide next to it, just says endometriosis lesions. That's just an example of some of the places that it can implant. So it can implant on top of the uterus, around the bladder, around the bowel, on the ovaries, but it can also be found in any organ in the body. So it's been found on the lungs, it's been found on the diaphragm. Last week, it was confirmed to have been found on the spleen. Everyone once originally thought. So what are the symptoms of endo? So I briefly touched on some of the symptoms that I experienced. So I really had a lot of trouble with that heavy bleeding, that lower back pain, and that really bad pelvic pain as well. And sometimes when that pain would get that bad, I would feel incredibly nauseous. So a lot of people experience pelvic pain and cramping. They experience that heavy bleeding. Fatigue is a massive symptom within the endo community. And that can correlate with an iron deficiency from extreme blood loss, or it can also just be due to that disease process and the role of inflammation just being a tiring thing on your body. Additionally, you can experience painful intercourse. You can also have pain during or after bowel motions, lower back pain, like I said, and also nausea. And I think it's also important to note here as well that the symptoms and pain, they don't actually correlate with the extent of the disease. So you could have stage 1 endometriosis. There are 4 stages, but you necessarily don't need to be in no pain at all. The amount of disease or the amount of pain you're in, they don't correlate. So you could only have a little bit of endo according to the stages, but you could be experiencing symptoms really badly and suffering quite in quite an extreme way. However, some people, they can have stage 4 endo and they might not experience any symptoms at all. So that is one of the really difficult things around diagnosing it, because there is that lack of correlation. So how is endo diagnosed? Endometriosis, it can only be diagnosed definitively via a laparoscopy. So a laparoscopy is a keyhole surgery, and you are put to sleep under a general anesthetic. They make tiny little cuts in your stomach, and they expand it with some gas, and they put a camera in there called a laparoscope so they can have a really good look at what's happening inside your pelvic area and get a good look at all of your organs. And it's an explorative tool to really look at what's happening inside. So it is quite frustrating that at the moment the only way to diagnose endo is through a laparoscopy. However, that is the gold standard. And also just making sure that you're having excision surgery, because there's also a different type, which is ablation. And that's actually where endometriosis is burned off. And if we're burning off endo, it can be associated with higher rates of reoccurrence, and it can also damage other organs just due to the heat of the laser that it's being used to burn. Whereas if we're excising that endometriosis, you're actually cutting out the whole piece of tissue that you can see, and then it can be sent off to the lab for histological testing, and it can actually confirm that yes, that is in fact endometriosis. And it's just also associated with less reoccurrence, better quality of life, and a reduction of scar tissue as well. So excision surgery is a procedure, and it should be performed by a surgeon who is highly advanced in this procedure, because it does have really technical skills. So you really do need to make sure that you are seeing an excision specialist. And QENDO have a list of specialists throughout Australia who specialise in this as well. So what is the role of inflammation in endo? So we know that endo is an inflammatory disease, and it's really estrogen dependent. So that means that it's like estrogen, and it's often treated by progesterone. So that's why when we're managing endo, a lot of treatments involve the oral contraceptive pill, Mirena, um, different hormonal options that are involving progesterone, because you're trying to counteract that estrogen dependence. So another interesting fact is that although endo is benign, it also features some of the similarities to what cancer does, and that is angiogenesis. It's actually attaching itself and invading other organs. So there's a lot of research coming out that endo should actually be treated in the same way as what cancer is, just due to the similarities there. And now we know that there's also an impact around immune system dysregulation, and that's implicated with that endometriosis lesion growth as well. So what we want to do is we really want to work to reduce that inflammation. So that's key for that ongoing management of endo. So, how can we really reduce that inflammation? A lot of people might not like to hear this one, but a common source of inflammation is actually food, and it can trigger an immune system response, which can cause those gut symptoms. So, that can include constipation, diarrhea, reflux, bloating, and pelvic pain. And some foods that can commonly cause this include our processed and refined carbohydrates, dairy products, alcohol, caffeine, sugary beverages, trans fats, gluten, and wheat. However, before you go cutting out all of those things, it's really important to work with a dietitian or a nutritionist or a naturopath just because they're the experts in the field. And you might not necessarily need to cut out all of those things. They actually work with you to determine what triggers you, and they can make a plan with you together. So you don't have to miss out on all the things that you love. So I would definitely suggest, if you are experiencing some inflammation that's causing some gut symptoms and things like that, that you could look into making an appointment with a dietitian, nutritionist, or a naturopath. Now, another source of inflammation is actually stress. And I think everyone relates to stress because everyone experiences it in some form or another throughout their day. However, when we're experiencing stress, especially when we have endometriosis, it triggers an immune response as well, or a mast cell response. So, what we want to do is try and reduce that amount of stress to help reduce that inflammation. So, different ways that we can reduce that stress is through moving our body. You don't have to go really hard at the gym or anything like that. I know from personal experience, when I'm in a really massive amount of pain, the last thing I want to do is go to the gym. Finding a form of movement that you love. So for me, I love going to Zumba and I love doing Pilates. So finding things that work for you. Also, there's a lot of really good research coming out around the use of essential oils, candles, and mists in your environment, and just that sensory release around smell that can help to relax us. Connecting with loved ones and talking, even just getting a hug. I know COVID stopped us all hugging for a bit, but there's so many amazing hormones that get released that help us to relax when we do get that hug. Again, reducing our caffeine intake, which might not be what people want to hear, but caffeine can really increase those cortisol levels. So reducing our intake can help with that. Writing your stresses down. So if you're putting pen to paper or even writing it in your phone, just talking about what's stressing you can just sort of get it out of your head, and you can move on with your day. Another one's just learning to say no. So if you've got too much on at the moment, maybe just park it for the moment, or you could say no politely. If you're saying yes to someone else, you're saying no to yourself. So just thinking of it in that sort of frame of mind is, how much are you willing to say no to yourself instead of saying no to somebody else? We're practicing mindfulness meditation, not mindfulness medication. I've made a typo there. But so there's also a lot of good research around the benefits of mindfulness, as well as the benefits of listening to relaxing music and doing that deep breathing as well. Also, being prepared. So, just trying to do as much as you can while you do have that energy that can set you up so you're not stressed later down the track. Focusing on getting that good sleep. Everyone knows how important it is to get a good sleep, just to work at reducing those cortisol levels as well. And also just prioritizing and organizing. So, sort of just fits in with being prepared, just so you're working on what's most important to you, and the other things can wait usually. Now, I just want to touch on some common myths around endo, and these are some of the most common ones that I hear regularly in my role at QENDO. So, I've picked the 6 most common myths around endometriosis. So, the first one is getting pregnant will cure endo. I wish. we don't have a cure for endometriosis at the moment. So people can find that relief while they are pregnant just because of the hormonal changes. However, some people also experience endo symptoms throughout pregnancy as well. Another one is that hysterectomy will cure endo, and no, unfortunately, as well, that one's not true. So we've actually got some research showing that endo, it actually creates its own estrogen, and it's not reliant on the estrogen that's being produced in those ovaries. So unfortunately, a hysterectomy is not going to cure endometriosis because the lesions can still remain and they can create their own source of estrogen. So even if you had a total hysterectomy where your ovaries got removed as well, endometriosis can still it can still have some impacts for you. So also, like I've said down the bottom as well, they're found in other places than the ovaries or uterus. So if you've got endo on your bladder and you have a hysterectomy and the endo hasn't been removed, that endo is still going to stay there and it can produce that estrogen. So yes, unfortunately not. Hysterectomy is not going to cure endo, and neither will the hormonal treatments. So like I said at the start of my journey, they can work for a while around suppressing symptoms. However, they're not going to cure endo. Usually, they won't work for after a period of time, and all of those same symptoms are going to return. So, the gold standard for treating endo is that excision surgery, which I mentioned earlier. And then once you've had that excision surgery, all the endometriosis has been removed. Hormonal treatments are a great option to be used alongside other forms of management, and that can assist in your management of endometriosis. Another myth that I hear so commonly, and I was the same, is period pain is normal. I thought it was normal to put up with excruciating period pain for so long. So that's why I didn't get it checked out for a bit, but it's not normal. So 1 to 2 days of discomfort that you can manage with taking NSAIDs or paracetamol or something like that, and it's not interfering with your daily activities, that's normal. But if you're experiencing more than 1 to 2 days of pain, you're taking that ibuprofen or paracetamol and it's not working and it's interfering with your daily activities, then it's time to get checked out. That's not normal. Another one we hear regularly is that endometriosis is just misplaced endometrium. So, like I said earlier, the endometrium is the lining of our uterus. And for a while, there was a common belief that this tissue was the same tissue as what endometriosis is. However, research has found that they're not the same. So, endometriosis is a similar tissue type, but it's not the same. Also, one that we hear quite regularly, and I've had it said to me personally many times, oh, you're too young to have that. That only affects people in their 30s or 40s. So I'm here to say it's not the case. Like I've said, there's 7 and 8-year-olds that have been diagnosed with endo. They can suffer with endo from the onset of their first period. So I started experiencing symptoms at 14. I know so many other people who have as well. Teens are not too young to have endo. So if you think you have endo, what do you do? There's a lot of great options at the moment. So QENDO developed an app last year to help track your symptoms. So just keeping track of what's going on for you and see if you can notice any patterns or what's happening regularly. So are you having really bad cramping? Are you getting really bad back pain? Are you bleeding really heavily? Is your period irregular? Do you feel really nauseous? Are you getting migraines? Anything like that. You can track that in an app. So the QENDO app's great for that. Or you can also just go old fashioned and write it in a diary as well. Once you've got a little bit of data, so even just a month or two, make an appointment with your GP. Say, I think I might have endometriosis. I've done some tracking, I've done some reading, and it really does sound like I've got this. And ask to be referred to an endometriosis specialist. And like I said earlier, we've got a referral list available Australia wide, and we've got some amazing specialists on there that can help you. And then when you do get that appointment with your specialist, you can take your app or your diary and just discuss those symptoms with them. They'll probably ask you lots of other questions as well. And we've got blogs and we've got different articles around talking about what to do at your first specialist appointment. And I just thought this would be a nice little slide to include here, because there could be some people in here tonight who are supporting someone with endo. They might not necessarily have endo themselves, and they might be just here to find out a little bit more and see how they can support somebody who does have endo. So I think the number one thing you could do is listen. It can be really hard having a chronic condition. Carrying everything around is really tough, and it can just be really draining. So just being there, listening, and, just saying that sucks, or I'm sorry you're going to have to deal with that, or I'm sorry you're going through that is enough. You don't need to problem solve. You don't need to fix it. Just listening and being there for them is enough. Also learning. So taking the time to look into endometriosis. So if you're here tonight because you're supporting someone with endo, this is a great place to be. Having a general idea about endo just means that you can be an advocate for them as well. They don't have to carry all the burden alone, because you also know what's happening, and you can be a really great support person for them as well. Additionally, is just being flexible. So sometimes when we're making plans, we might be feeling amazing when we do it, and then the day comes and you've had a flare, you're not feeling up to it, and you've got absolutely no energy. So just being empathetic and understanding that if we do need to change plans or reschedule or anything like that, just being understanding, it can just make it so much easier for that person, because oftentimes they can experience guilt for cancelling, and frustration with their body that it's letting them down. And also offering an alternative suggestion. So maybe even just offering to stay at home and hang with them, or come over and hang at home instead of going out for that plan that you'd initially planned to do. So how can QENDO help you? So QENDO, we offer support, education, awareness, and we champion research for anybody who's affected by endo, adeno, PCOS, or infertility. And we do this Australia-wide. We are also in New Zealand as well. And we've got a number of resources available, which I've listed down below. So we have our 24/7 helpline, so 1-800-ASK-QENDO. We have a lot of education videos in our members hub, and our members hub is free. We also have our free QENDO app. We've got our local community groups, so they are available via Facebook as well, but we've got our QENDO meets where people meet up to get support in person. We've also got lots of resources like our blog. We've got our members hub with different ebooks and different PowerPoints and things like that in there. We also have our events. So this weekend we're hosting our long lunch in Brisbane. So we've got 150 people coming along to that one. And we've got a number of other events happening across Australia. So I think next weekend we've got our Canberra endometriosis picnic. So events are just a nice way to support QENDO, but also connect with others. We also do a lot of advocacy work around policy, talking with government, trying to make change from the top down. So lots of advocacy work. We also have our counselling service as well. And that's available online Australia-wide. So we've got a beautiful counsellor, Amanda, and she specialises in chronic conditions. And then we also have our Let's Talk Period podcast, which I host. So that's available on Spotify or Apple, or wherever else you get your podcasts. And we talk with professionals, people, all about periods, pain, endo, adeno, PCOS, infertility. No topic is off limits. So that's a little bit about QENDO. And so, yeah, if you've got any questions or you have any comments or you need support yourself, this is how you can find me. So I'm on Instagram in a few places. So the QENDO account, our Let's Talk Period account, or my personal account. My email's there as well. So secretary@quendo.org.au. Our website in general is just quendo.org.au. and the phone number. So 1-800-ASK-QENDO. So 1-800-275-736-36. And that's all from me tonight. So I thought we could dive into some questions. Oh, and
Isabella,
there's our references as well.
Isabella, thank you so much. That was such an informative and resource-packed talk. I mean, there's just so much in there, and we're really, really grateful. I'm going to put your handles where people can follow you and the work of really important work of QENDO Australia in the chat box as well shortly. And we'll also be sending out some of that information to our attendees tonight along with the replay in the coming days.
Amazing.
So we have had a few questions come through. I'm going to start with the ones that that came through from the drop-in community during the week, and then start working through some of these questions. If we don't get through all the questions tonight, if yours isn't answered, please know we will do everything we can to get them answered and catch up with Isabella in the coming weeks. So let's dive into it. The first one that we have is from somebody who said, I didn't realize just how common endometriosis was. Are many women living with it but unaware, do you think?
Like I said, it is tricky to diagnose because you do have to have that exploratory surgery, and also the lack of correlation between symptoms and pain. So you might be walking around with endometriosis and you might not even know. For example, my auntie recently, she went in for an ultrasound just randomly for something else, and the specialist was actually, or the ultrasound specialist was a tertiary scanner. And so he could actually look at the scan, and he said, oh, you've got endometriosis. And she's in her 60s and she had no idea that she'd been living with it for all these years because she just hadn't experienced any symptoms. So there is quite a possibility that there are lots of people walking around with no idea. So although it's 1 in 9 diagnosed by age 44, the statistic could actually be quite high in comparison, actually. So it's just really about finding awareness, so raising awareness, increasing education so people actually know what to look for, so we can get more of a informed idea about the number of people with endo.
Yeah, absolutely. Thank you. Now we covered this a little bit around pain and symptoms and whether or not people have it. But one of the questions that did come through that I wanted to ask was whether it can be present without any pain or without period pain.
Definitely. So you don't need to have that period pain or pelvic pain to have endometriosis. So you might experience other symptoms. So that could just be that heavy bleeding or that fatigue, or you might just feel really nauseous when you get your period or things like that. So although pain is quite a good indicator that there's something wrong, there can also be other symptoms that you can experience if you're not necessarily having that pelvic pain.
Okay. We've had a few questions around diagnosis. The first is how to get diagnosed. I know that you've mentioned there's a number of resources on the QENDO site. And the second is whether or not there may be potentially another means of diagnosis rather than the invasive, what they've called invasive laparoscopy. Sorry, haven't I said that wrong?
Yep, laparoscopy. Yeah.
Laparoscopy, yeah.
So there's a number of diagnostic tools that doctors can use. So there is evidence around the use of tertiary scanning for endometriosis. So that's an ultrasound scan performed by a special ultrasound technician, and then it's read by an ultrasound doctor. And that can sometimes show the presence of endometriosis. However, the next step there is to have that laparoscopy, to have the excision surgery to then remove it. Additionally, MRIs can also sometimes show endometriosis. However, they're usually more successful in looking for adenomyosis. So that's a similar condition to endo. So at the moment, really, to get that definitive diagnosis, laparoscopy is really the only tool that we have. So that's why it is important to get that awareness out so we can look at finding alternative ways to diagnose people without having to go under such a invasive procedure.
Thank you. So we had a few questions, and we've touched on pregnancy and perhaps the myth that it can temporarily sort of cure endo. A lot of people do seem to say that their endo goes away when they are pregnant, and we've had one person who says that their endo seems to have gone after 2 babies. Wondering why, and how long generally would it take to return after pregnancy?
It really depends. So sometimes post pregnancy, if you're breastfeeding, those hormones can also act as a sort of preventative measure because they're also inhibiting your period returning. However, sometimes uh, for lack of understanding, we're still not 100% sure. Uh, Endo, you might just not experience the symptoms post baby. There's no real key criteria around how long you'd expect before it returns. That's why it is really important to have that specialist who you trust and discuss these things with, because they know you, they know your body, and they'll be able to give you a more informed answer around that.
I might just jump in there.
Not a
Isabella,
problem.
I think we might have lost Abby. So hi,
That's
everybody. I'm
fine.
Monica. I'm the content and community manager here at the Drop-In. So I'm just going to jump in because we've got a lot of questions here. So we'll try to keep getting through them as we can. Bear with me. I'll just pop on to the next one. So one of the ones that we've had a few questions along this thread were around people saying, how do you get diagnosed? Lots of doctors are putting people on birth control and they're not sure if there's symptoms. So I guess, are there any tips that you can recommend for people to kind of either tools that they can use when they're going to the doctor or ways that they can get the diagnosis that they think they have?
Definitely. So, like I said, tracking what's going on for you. So, having a really good record of what's happening for you through either an app. So, it doesn't have to be the QENDO app. However, we did design it for endometriosis specifically. So, it has a lot of the data that you're already going to be looking for to track anyway. Or you can also just write it down pen and paper wise as well. So just things that are not normal. So like I said, that pelvic pain, bleeding, our cramping, our back pain, nausea, any pain with bowel motions, do you have pain with sex, things like that. Also, when you're going to the gynecologist or the specialist, the things that you're thinking about or wanting to ask around like, how long does my period last? Is it over 7 days? So the regular length for a period is only 3 to 7 days. So if you're bleeding for longer than that every month, that could be a red flag for you, literally. Is my period heavy? How severe is my pain? Where's the pain located? So is it right side, lower pelvic pain? Is it up higher, right near your lungs? Or is it back pain? So where is that pain? How severe is that pain? Are those over-the-counter painkillers assisting with relieving the pain, or are they not really touching the surface? And is that pain stopping me from doing those regular activities? Are there any other symptoms I feel that aren't normal? So those are questions that you can think of before heading in. And then when you're with the gynecologist, they're going to ask you things around the history of your periods. And they've got a lot of questions that they're going to want to know. So did your mum or auntie or grandma or sister experience endo, or did they suffer from anything similar? They're wanting to get sort of a history, because we know that there's a 70% genetic link around endometriosis. So if someone in your family had it, there is a higher chance of you having it. So they're wanting to get that family history. They are also going to want to know all those things you've been tracking as well.
And I guess as well, would it be safe to say, if you feel like you're not necessarily getting the answers, you can always look at another gynecologist and get a second
100%.
opinion as well?
Like I said in my journey PowerPoint slide, I literally went to 4 gynecologists before I got my answer. So there's absolutely nothing wrong with going and getting that second opinion, getting that third opinion, getting that fourth opinion. You know your body better than anybody else. So if you aren't happy with the care you're receiving, you're more than entitled to go and find someone who will listen to you.
Thanks so much, Isabella. Good to have you back, Abby.
Oh,
I'll hand back over to you.
The internet dropped out. What amazing timing, but thank goodness for our incredible community manager, Monica. Thank you for stepping in there. Mon, I'm happy for you to keep asking the questions, given that my internet might not be as reliable, if that's okay with you.
Yeah, of course, no problem at all.
Thank you.
So one of the ones we've got is around the laparoscopic, and apologies if my pronunciation is incorrect. I've been reading it a lot, not pronouncing it. It was a question around the incision surgery, and if you could talk a little bit about the scar tissue from the surgery and how you can go about managing that as well.
Definitely. So if you are having excision surgery and not ablation where it's being burned, the likelihood of developing that scar tissue is actually less. So you're less likely to develop scar tissue or adhesions or things like that. However, it's not guaranteed. Ways that we can manage that is doctors, when they're actually in there doing the procedure, there's fluid that they can use that can assist in keeping things mobile just while things are healing. There's also special, not gauze exactly, but kind of like a gauze that they use to cover while things are healing internally to assist with not developing any adhesions. Alternatively, what you can do as well, once you've been cleared, is working with a pelvic physiotherapist. So that can really assist in getting that movement internally and loosening things up. And additionally, working with an osteopath as well. They're really beneficial for that fascia release and helping to keep things really nice and loose and flowy and not tight and cramped up.
That's great advice. I think a lot of people, especially in the post-recovery, it's understanding what else you can do outside of just, you know, taking the medication, pain meds, and then after that, I think osteo referrals and things can actually support you in a much bigger way. So the next one we've got is around, I'm going to jump to one around cramps and how you manage those cramps and pains. The question is, do you usually manage this the same way as when you're bleeding, like heat packs and things like that, or are there other ways that you'd give advice around the mid-cycle ovulation cramps?
Definitely. I used to get ovulation pain so badly, and I just want to crawl up into a ball and wait for it to pass. But that's probably the worst thing you can do. So although you might not feel like it, actually just stretching really gently can help. So we've worked with some amazing exercise physiologists to develop some resources. So they've given us some stretching guides that they've developed with just really gentle stretches that will assist in just opening up that pelvic area, opening up that abdominal area to just release some of that tension. And also the use of a heat pack is great as well. So not super burning hot that you're going to burn your skin, because I've seen some horrible burn marks from people getting their heat packs too hot. But heat packs, also magnesium spray, so rubbing that onto your, or magnesium cream, and rubbing that onto your pelvic abdominal area can be really beneficial as well, because magnesium is a wonderful supplement for reducing cramping, so it can be really helpful to apply topically. Also, just trying to not crawl up and cramp up into a ball. So even if you're just lying on the ground with your feet against the wall or things like that, to try and open up.
Great, thanks so much. This next question I find quite interesting. It's in regards to IUDs, and I think you mentioned earlier you had 2 IUDs. So the question is, how did you get 2 IUDs inserted at the same time? Isn't there only room for one in the uterus?
Oh my gosh, I know. So IUDs, they're not very big. They're like only about that big, and our uterus is quite a bit bigger than that. And it is a muscle, so it can expand and contract. So there is room for 2, and you do need to have a specialist insert them. And I had them done under general anaesthetic during my laparoscopy. So they were done through a hysteroscopy where it goes up through your vagina to insert them that way. There's room for 2, but obviously speaking with your specialist, and I only have 2 just because of my adenomyosis and needing a higher level of progesterone. So it just depends on what your doctor is looking towards treatment goal-wise, and what the best management strategy is for you.
Great. And in terms of, this is another interesting one, in terms of any visible cases. So one of our guests has said that they had it and it grew out of their belly button. So have you heard of other cases of that kind of form of endometriosis?
I haven't heard of it growing out of somebody's belly button visibly, so that's an interesting thing to hear, you poor thing. I have heard of people developing endometriomas very close to the surface, so on their abdominal wall, so on their muscles, and that actually starts to protrude and they've got a visible lump and it's an endometriosis lesion, so not necessarily penetrating the skin, but very, very close to that top layer.
Wow, I feel for anyone who's got to experience any form of it, but that especially would be particularly challenging to then have the physical barrier as well. So one of the other ones, we've got so many, so I'm trying to get through them, but if we don't get through them all, we will do a follow-up with Isabella and make sure we cover as many as we can that we didn't manage to do tonight. So this one is around a link between chronic fatigue, how to manage the fatigue and body pain. Sometimes this guest has stabbing pains down their legs, backache, and intense pelvic cramping.
Yes. I'd also just recommend potentially looking into adenomyosis as well, because those are really key symptoms of adeno as well. So that shooting leg pain down your back is like back of your legs is a characteristic sign of adeno. So it could be worth looking into that as well. But managing fatigue is simply looking into how much you can do a day. So your energy levels will peak and they will be down in the dumps sometimes. So just sort of working on what you can do in the day and prioritizing that. So if all you can do is get up, shower, have some food for the day, and then the rest of the day you're just curled up and laying on the couch or whatnot, that's giving yourself the grace and, you know, being kind to yourself and gentle and nice and not beating yourself up, because it will just make yourself feel worse, because your energy levels will return on another day and you'll be able to do more then. So it's sort of just being in tune with your body, listening to what it's asking for and giving it that. So then you can manage those levels. We also have our QENDO mentor program as well, and that's a free program, and it talks about fatigue as well in a lot more detail. However, I'd be looking at our sleep as well. So are you getting a good sleep? What you can do to improve your sleep hygiene routine. So is your room cool enough? Is it dark enough? Have you got a pillow mist? I love a pillow mist. It's a bit of an extra, but it's sort of that nice calming smell. So just looking into ways that you can get that really deep, nourishing sleep.
Oh, great. We'll probably only have time for, I'd say, one more question. So I thought this one could be quite useful because a lot of people on the journey who have kind of reached that final point and decide to have surgery might find this quite beneficial. So the question is, are there any tips on preparing for the surgery? Because this person's having their first incision, and they just want to make sure they're not too anxious on the day.
Definitely. I've actually written a blog on preparing for your surgery, and
Amazing.
I've also written a blog for preparing for post-op as well. So I can share these with the Drop Bio people as well, and you girls can share them with the community. But top tips for preparing for surgery, making sure you read any notes that your doctor has given you for pre-op really thoroughly, because it does have really important information, like what time to start bowel prep if they want you to have bowel prep. What time do you need to stop eating? What time can you have your last drink of water, not anything else? And if you do have to start a special diet a few days before your procedure and things like that, what foods you can have, what foods you can't have heading into the procedure. So just reading through that. Also having a hospital bag prepared, because although a laparoscopy is usually a day procedure, sometimes Even if the procedure goes really well, you might not wake up very well after anesthetic, and they might need you to stay in overnight just for monitoring, or you might not be able to get your pain under control and they need to keep you in to manage that pain post-operatively. So having a bag ready just makes things a bit easier on you. It can have your lovely comfy pajamas. It can have your little comforts from home. So a nice blanket, things like that. I've got a whole list in the blog, but just being prepared with that ready to go. Also, not doing anything the day before, just if you're doing bowel prep, because it can be quite horrendous. Staying at home, staying nearby a toilet, just trying to be as calm as you can. And then the morning of the procedure, I used to cry like crazy, no matter what. Even when I knew I had endo and I knew it was just going in to get new marinas or IUDs, I'd still cry just because of that anxiety. However, when I had my most recent laparoscopy in January, I was just really good with being mindful and talking myself down and saying, no, this is okay. You don't need to cry. Obviously, if you feel like you need to cry, you can totally do that. I was just trying to talk myself out of it because my mum gives me the nickname the Wesley Weeper because I cry so much pre-surgery. But yeah, so just trying to be as relaxed as you can. So having those comforts, I took my earphones in with me and my phone, and I listened to an audiobook all the way up until they took me into theatre. So trying to do those little things to keep you relaxed. And then post-op wise, make sure you've got some meals prepared at home already. Try and make sure your house is as tidy as it can be so you're not bending over picking things up. Really take time off work. So as much time as you can have, take it because you'll need it. You might hear people saying, oh, I was fine after 3 days, but really give yourself that time to recover. And if you are feeling good earlier, then that's great. You can just take that time and really feel even more ready to return to work or school. But otherwise, if you go back too early, you can just end up in more pain, and it can just cause a few setbacks post-operatively. So giving yourself that time as well. But I've got so many more tips in both of those blogs as well.
Oh, thank you.
Fantastic advice.
Yeah,
I'll hand back to you, Abby.
Oh, yeah, thank you so much.
Thank you.
Apologies. I think I'm in the middle of an electrical storm here. The
Oh,
lights
no.
it's all happening. Yeah, we'll definitely share those blog posts with our community. Absolutely. We'll try to get one in the next email that goes out. We haven't been able to get through all the questions, but as I said, we absolutely will endeavour to answer because we really appreciate everyone's attendance. Isabella, you are a Wonder Woman. And I truly mean that. We really appreciate you sharing all your time and wisdom with us this evening.